when you consider meniscus surgery, you're basically talking two things: either trim it or repair it, and that's in the very beginning for the first treatment. Meniscus transplantation would be later in general after someone's already had treatment for a meniscus tear. So those are the two things that we'd be thinking about. When the tear is in the region of blood supply of the meniscus, you would be thinking about repairing it. So a tear, if that meniscus is a ring that sits in your knee, a tear that's in the peripheral third or of the meniscus is generally a more repairable type tear, and you can suture it. A tear that the inner 2/3 of the meniscus don't have any blood supply, so they're not ideal for suturing them. They would have a high failure rate if you suture them. In general, older patients, degenerative patients after age 50, very, very few of those would have a meniscus repair. There's another type of tear that's called a root tear, where the meniscus pops off in the back, and that is a tear that we would tend to repair in a young, healthy person with a healthy knee. That tear pattern's more common in older people over 50 that have a degenerative knee as well, so we might be less likely to repair it then. But it really loses its function. It's kind of like a bucket handle that loses one attachment. It just moves when it gets loaded. So it's kind of a subtle motion, but when you stand on it, it kicks out a little bit or displaces, or we call it meniscal extrusion. It kind of squirts out when you stand on it. So that's a less common tear, but that is one of the ones that you would be thinking about repairing. The run-of-the-mill, everyday meniscus tear, I would say 80% of them are probably trimmed.